Welcome to Think Like a Pancreas, the podcast. Our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in the program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Since this is a very individualized condition, please check with your healthcare provider before implementing any of the weird stuff we may happen to share with you today.
Welcome. Thanks for joining us today. My name is Tavia Vital. I'm a registered nurse and a certified diabetes care and education specialist with Integrated Diabetes Services. And I am joined by two of our clinical social workers who are also CDCESs, diabetes educators like me, but with a background in social work. And they work with families, kids, adults, families living with type 1 diabetes. And I will let them introduce themselves and tell a little bit more about what they do. So, Anna.
Hi, excited to be, back on the Think Like a Pancreas podcast. But my name is Anna Sabino. I also live with type 1. I have a master's in social work and I'm a CDCES. And I truly focus on the family dynamic piece of it, understanding the stressors that the entire family has after a diagnosis and how to sort of best navigate through the psychosocial, emotional aspects of that. And sometimes that means dealing with comorbidities and additional diagnoses that I think we'll get into today. Kristi.
Yeah. Hi, everybody. I'm Kristi Paggio. I'm a clinical social worker, CDCS, and my specialization area is in the mental health side of diabetes. And so the topic of ADHD and diabetes is why we're here. I'm looking forward to our conversation.
Great. Yeah. So thanks for joining us on our podcast today, those who are listening. And our focus is we're going to talk all about type 1 diabetes and ADHD together. So just starting, let's talk a little bit about what do you guys think? Do you see ADHD people living with ADHD and type 1 diabetes? Is that something you guys see? Because I see it on my side with the clinical diabetes education side of it. Yeah, both nodding yes.
Yeah, I've seen a huge influx of kiddos and families with both. Whether one comes before the other, I don't think we know enough info about that yet. I think something that we do know is that there is an increase in research out there that indicates that volatile blood sugars, like DKA, severe DKA diagnosis, severe low blood sugars can have an impact on the gray matter in our brains, which impacts our ability for these, levels of executive functioning skills to be present, which we all know we need so much of to manage the day-to-day in diabetes. So, Kristi, what else do you see a lot of overlap?
I think what I see in my practice is more the challenges of just staying on task with the diabetes. Just life in general is so difficult, and then adding in the layer of all of what the diabetes regimen brings is so hard. I think in general, people with diabetes don't feel like they nail it every day, and I think people with ADHD even more feel like they've got more stacked against them. Yeah, definitely it's like the decision overload almost of yeah, like trying to factor in like what's happening in what am I doing right now? Am I pre-bolusing? Like, what am I doing? And like, just the nature of diabetes kind of makes everybody feel like we've got some attention deficit stuff, let alone
for sure
technology.
Yeah. I mean, I feel like I have diabetes and even just giving one dose of insulin, there's like 7 or 8 different internal monologues happening in my brain. Do I give this much? Am I walking the dog now? Am I walking him later? Where does that come in? And every decision we make has an opportunity for guilt, for shame, for regret. And I think some of those negative connotations in terms of the impact of those decision making, if you have something like an ADHD, are going to make the, irritability and the frustration and the outbursts, like any type of hyperactivity, it's just going to be exacerbated if you already have that on board. Now, Tavia, you are living with diabetes yourself, but also have it in your family. What can you share with us, like from your son's perspective, your perspective, what are some of these sort of like symptoms overlapping that you may see on a day-to-day basis?
Yeah, and I think one thing before I do that, I was thinking about as we were talking is maybe we should go over just a little bit what are we talking about with ADHD? What are
Sure.
some now, one thing, if you describe any condition or disease, there is a much bigger list of symptoms or
Oh, yeah.
common experiences than any three people could just list out in a couple of minutes. And each person's experience with living with, we could be talking about type 1 diabetes, we could be talking about ADHD. Every person's experience or their level of symptoms or frequency or maybe distressing symptoms, that's going to vary. So we did talk before this, and we want to make sure that everybody's clear that we cannot diagnose ADHD. As we're describing some common features of ADHD, we aren't trying to give you a checklist for you to go down and be like, oh my gosh, I have ADHD. That's not our goal. So we're just talking about what
we're bringing the awareness. We're having
Yeah.
a conversation about it because we are starting to see it more often.
Yes.
And want to validate that if you're out there and you are dealing with it as a parent, that you're not alone. Because
Yes,
we,
exactly.
from our side at IDS, we see a lot of it too. So,
Yes.
all right, Tavia, back to you.
All right, so we were going to talk about some of the common symptoms. So I could just kick it off with what I saw at home that led me to go get my son evaluated to see if he had ADHD. So you mentioned executive functioning. And so what that involves, typically some of the symptoms that we notice anyway, where if you give a young child 3 instructions, go pick up your shoes, go put them on the shelf, and then close the door. He would get one of those, but the other 2 it'd be like we didn't have the conversation. He just couldn't. And I kept getting frustrated because I'd be like, put your shoes away, grab your backpack, let's go. He'd come with his backpack and no shoes, or he'd come with his shoes and be sitting on the couch. And I'd be like, what are you doing? He'd be like, what? I put my shoes away. Right. And so it just, that's the executive functioning piece of being able to listen and follow through. And then the decision making. So if you know you need to get ready in the morning, you know the steps. You got to brush your teeth, eat, get dressed, put your shoes on, get your things ready. There's a certain time frame you're working within to get out the door on time without being late, right? Which is a challenge for everybody, and especially kids or parents of kids, right? But somebody with ADHD may not be able to do those things. Like they just can't on their own. So we had to do things like put his clothes in little bins ahead of time, Monday, Tuesday, Wednesday, Thursday, Friday. We had to label shoes, go here. And then we had to be the timekeepers because he couldn't do it even as he got older. And then with schoolwork, if you have a semester long project and they give you instructions, the teachers, they say, start with an outline, do your research, then do this. He couldn't do those projects. So he'd just get overwhelmed and then he'd wait till the last second. And then he'd be struggling the last few days trying to get it all done, which is nearly impossible. So we got him evaluated. So that's what we were seeing at home.
Yeah. And I think, thank you for sharing all of that because yes, it's very common in kids. And like you said, those are only like some of the characteristics of, ADHD. I think a lot of people think that, the impulse, lack of impulse control, dysregulation in terms of, going from like 0 to 100 from an emotional standpoint is very common. And I also know that hyperactivity doesn't always mean an automatic ADHD diagnosis. But when we talk about diabetes, could you share some of those sort of like diabetes related tasks or executive functioning type, behaviors that you felt like were really challenging?
Yeah, I think it is, it's interesting because when he was younger, his ADHD symptoms were more pronounced and got in the way of his quality of life, his happiness, his joy, and his ability to feel like he could do whatever he set his mind out to do. And as he's gotten some tools and training and learned about ADHD and the symptoms and some options for management, his ability to do the tasks in a timely way has really dramatically improved over the last few years. So he was diagnosed with type 1 diabetes at age 12. He's 16 now. And so in the beginning, when someone is first diagnosed, you're not going to expect them to like do all the things. They can't check their blood sugar and know what the glucose result means, and know that every 3 days there's a pump site change, and know how to count every carb and so forth, right? That's just, you have to learn all that, and it's a process for anybody. So once he was through kind of the new learning phase, then what we did is we set up structure, because he would do his pump change at like 10:59 p.m. when he was supposed to go to bed at 10, right? Like those were the things that kept happening. Or he'd be like, oh, I used all the insulin, I forgot to tell you, and I have to change my pump site. And I'd be like, oh, but you know, he was young. So once we were transitioning, that was about age 13 to 14, where he was like, I can do these things. That's where we started seeing some of the gaps that were like using the last bit of insulin. So then I had to make sure I was really overseeing it from the background, letting him do the work that he was ready to do. But I really had to make sure my calendar showed me when it's time to change a sensor and a pump site and renew his insulin a week before he would get around to telling me he might be running low. He would forget his bag. He'd forget his diabetes kit everywhere. So we had extras. We left one at the nurse's office, one in his locker, one for his backpack, one at home. And then there's a spare one for wherever he's at without it, because he just would forget it all the time. And he'd go somewhere without his, when he wasn't on a pump, he didn't have his insulin with him half the time. So I'd have to double check. My husband's taking him. Like, I know if you ask him if he has it, he'll say yes, but he needs to show it to you, because he would think he got it, because he'd think about the task and then not do it. But because he thought of it, he thought he did it. Like, that is another really common frustration. And then he would be frustrated with himself. Like, why can't I get this right? But yeah.
I was thinking as I was listening to you about how much diabetes is like this planning ahead all the time, and
Yes.
how hard that is to do without an attention, difficulty, neurodiversity, and like, and kids and just adult, like it's just really hard to do diabetes and always be 10 steps ahead. And then to have this like, in some ways, I don't know, like this extra ability to like like I was thinking about ADHD is like not necessarily a bad thing, but it certainly can in like our current culture and in the way that we work, that we're trying to like streamline things, and how internalized that can be, that like, what's wrong with me that I just keep failing at all of these tasks. And what I hear you doing, Tavia, is like trying to help him, trying to set him up for success, and like increase the environment to set him up for success, because ADHD is something that's working against him, but then add diabetes and that regimen onto it.
I think one thing that you said there that resonated with me, Kristi, is that something that I try really hard to do with my own kids when I'm frustrated. I mean, they're very little, they're 6 and 4, so they need a lot more help, but making sure that we're offering as much praise as possible, because like you said, diabetes is an autoimmune disease. A lot of times ADHD can be genetic. They didn't ask for any of these types of, lack of sort of organ function, for better or worse term. And so how can we help them? How can we be their best cheerleader on the sidelines as they like navigate this like constant, both external and internal frustration? And the kids that I see that do well have like a lot of one-on-one time with parents, and like very structured environment, and opportunities to sort of just like learn from the mistakes. So as we're talking about just like, okay, well, what works? Like, what does success look like? And what are some of those strategies? Like, how do I fix my kid? And it's like, well, you can't fix the kid, but we can fix how we interact.
Yes.
So, you know, something that I really try to do with any and all kids, my own and inspire parents to do is like really take a step back and think about, you know, the validation piece and you know, the praise, and just like acknowledge over assumption. You know, we assume all the time that either we ourselves or somebody else did something to cause a high or a low blood sugar. And we all know, living with diabetes, there's 80,000 variables in blood sugar fluctuation. And it can be so easy to blame the person and not the problem, which is obviously the autoimmune function, blah, blah,
Right.
blah. So making sure that we're just like, hey, thanks for checking your blood sugar, buddy. And acknowledge yourself that like, wow, I did a lot of work today in my diabetes.
And I think like in addition to that, it's like the number, because so often, right, we respond to the numbers, right?
Yeah.
Like I love that, like praising the behavior, reinforcing the behavior with positive,
Yeah.
right, affirmation, and then thinking, oh man, but what's the number going to be, right? And then the thought of like trying to neutralize that number of like it's data and we're going to use it to make decisions to try to not have this internal reaction to like, oh, why is it like this or like that, which is
Yeah.
so easy for any of us to fall into.
Right.
Yeah.
Yep. And
Yeah.
that's one thing, I mean, so if there is a benefit, right? So in my son's case, I've lived with type 1 diabetes for 150,000 years. So it wasn't like a brand new concept to him, right? So he had some built-in support that other families didn't. I'm familiar with ADHD and could recognize the symptoms. And it was a process to get him to the right place to get a diagnosis. And it took way longer than it should have because of all the fun with insurance. And no, you can't go there. Yes, you can go there. Just kidding. You can't go there after you waited for 3 months. Now we're calling you to let you know that no, not covered. And you have to find it, right? All the mess.
Oh yeah.
And so knowing about those things from my nursing background and life experiences then gave me the ability as a parent to help educate the family members around us about what, so he has inattentive type ADHD versus the hyperactivity part of it. What does that look like day to day? How can we communicate more effectively with him? What do we do if we're feeling frustrated because he didn't do what we said to do, even though he looked right at me and said, yeah, I'll do that, right? Because his personality is, he's a very good kid. He's a very genuine person. He really wants to please others. Like that's his nature. So we know, benefit of the doubt, if he didn't do something right, quote unquote, right, he didn't do it on purpose. He didn't do it to like show us he's a teenage boss man or something, you know, like it just is an honest omission usually. So I think, you know, he's in a family environment where most of us get that and can help facilitate it. So like even his younger brother will be like, you got your bag? You have Smarties? Okay, let's go play soccer. Because he knows if he doesn't ask, they're gonna have to stop soccer. He's gonna have to come back. And, you know, so I think having that, the built-in parameters and planning tools are the big pieces. And for, you know, I work with a lot of college students that have the dual diagnosis of ADHD and type 1 diabetes. And it's very challenging for many of those students to do college, right? They're living on their own. They're responsible for their own actions, going to bed, getting up, eating, taking insulin, all of the things, and keeping their diabetes safe. Because a lot of people with ADHD are really good in the moment. Right then, hyper focus, we can figure this problem out, but then it's the future and the past that are just not in that decision that's being made, which really with type 1 diabetes can really bite you.
Yeah.
Well, and I think it's a huge point. I was just going to say, I think, especially for parents listening, you know, assuming most of us are like 25 or older as parents, like our brains are fully developed. we have a full brain there that can think if this, then that. And unfortunately, impulse control, overall emotional regulation, those are some of the last parts of the brain to be developed. And
Yeah.
that usually doesn't happen until like age 20 to 25, even a little bit longer for young boys and men. So we have to remember that
Yep.
even without a formal ADHD diagnosis, managing diabetes is just like, we can't have the same level of expectations, even like 4 or 5 years after they move out, than we would for ourselves. I know for me
Right.
personally, I was diagnosed at 6. I didn't think about my long-term future until college.
Yep.
And I realize now, wow, my brain really wasn't developed, and that is all normal. It's
Yes.
maybe not ideal, but it's all normal.
Yes. Yeah.
As
So
I listen, as
go
I
ahead.
listen to you both, I think about a lot of my work is about helping separate like people's identity from diabetes, and just how more difficult. I was diagnosed with type 1 at 26.
Mm.
So I had gotten through all of that, like things were
Mm.
gelled, right? But like it was still absolutely, I was starting grad school, lived alone, like it was a very stressful, traumatic time. But what I was talking about a little earlier is like that so much of what happens is these things get internalized, the challenges of diabetes, the challenges of ADHD, or any other thing that like and so much of my work is trying to disentangle that and unburden, so that there's the coping strategies, but then there's also the impact on our self-esteem.
Mhm.
Yeah.
Yeah, and trying to lift that off of people so that they don't think lesser of themselves while they're doing these heroic tasks and trying to get things in place.
I'm going to share. You just made me think about something that we've been doing that we found helpful to sort of
Mm.
lighten the mood, but also to validate the experience, right? Because you can get super isolated thinking, living with type 1 diabetes, living with ADHD, put them together and like, you must be the only person, right? No, actually, there's a very high number of people who live with both conditions. But so one thing, and this, my son found this, and I think it's pretty fun. It's kind of it's an out of the box thing, but there are plenty of people on TikTok who make videos of what their life is like with ADHD, like how they go through their day. And if you are not a neurodiverse person watching them, you would think differently than somebody who is neurodiverse in a similar way. So we've been finding extreme joy in watching a few specific people because they'll say, here's how I go to work each day, and what it looks like and what their internal dialogue is and how they go from one place to another. And then there's some people who are, they're exaggerating it. So they'll show like, here I am cleaning the house for 5 seconds and I set my broom down here in the middle of the floor and then I go get a drink of water and leave the cap. Oh, it went under the stove and then the phone rang. And so then I forgot my keys, so I had to come back in, and then like it like goes on and on anyway. But we found that to be super helpful because certain people show maybe they do awkward things with their body. They hold funny postures compared to quote unquote normal. And then they'll say, this is me unmasking walking down the street. This is me saying what's just on my mind instead of not talking the whole day. And this is what I did today that was not what other people did today. And so that experience it was just, my son loves them. He finds these videos and he shares them and we sit and watch them and we're like, oh, hey, look, and that's been very helpful, I think, to see
I'm
that.
so glad that you shared that, Tavia, because I still think despite how much we have normalized like mental health and all, therapy and reaching out for support, ADHD and diabetes are both like very invisible. You can very much internalize them, easily take medication or easily change a pump site, and nobody knows that you're processing and dealing with all of that. So I think it's so important, especially if you have kids, for them to understand like, hey, it's cool. Like this is what we do. This is what it's about. And for him to be able to understand what tools work for him and verbalize that. So
Yeah.
I love that. I love that. Kristi, any, before we kind of start to wrap up, any other like tools that you feel like are just so important for people to have in their back pocket, or that you have heard clients say work really well out in the real world?
I can't think of anything off the top of my head at the moment, but the thing I was thinking about in our conversation today is, and I think TikTok is doing this a little bit, it's like a support system. It's like, how do we, like, I think TikTok can help explain, social, like these little clips, right, that can help demonstrate and teach the invisibility of what's happening in a person with ADHD or with diabetes, right? Like, but then there's also, I think about like how to educate, but then also activate that support system, which is really hard to do with emerging adulthood and that desire for independence and that goal of being independent, but also maybe peeling back the layers that like, some of that just comes from like our individualized, obsessed culture that is not the way that a lot of other cultures come from, more of a collect, like, so we need each other. We need to
Right.
use, and we shouldn't internalize the fact that we need each other. We need the support. But I bet you that that's part of this internalization from our culture of like, pull yourself up by your bootstraps, like,
Sure.
You can do it. You can do anything.
that's right. Instead
Right.
of like, we need each other. We need each other desperate, whether it's ADHD, diabetes, cancer, like,
Just
going through,
living.
Yeah.
yes.
Yeah.
Yeah, like you said, like this sort of like desire to be perfect and ideal. And, one of the best skills I feel like we can teach the younger generations is like this ability to self-advocate. And I feel like even as an adult, someone that has lived with diabetes over 35 years, really since I can remember, the biggest burden for me still is this burden of self-advocacy, whether it is the vulnerability of having to just constantly explain diabetes or pick and choose how and when to share what, or I don't know. Like yesterday, somebody asked me, the coach at the gym was like, what does that beat mean? And I'm just like, not right now. I suspended it so I won't go low. It's fine. And for whatever reason, it was like 6 a.m. I was at the gym and it bothered me. But it's like, but always have to remember that they don't know. And it's an opportunity as we sort of reframe all of this. It's an opportunity. It is an opportunity for us to share, for us to grow, and form this better connection with the people that love us and ultimately just with ourselves.
Great. All right. I think that our time is up already. I can't believe it. It seems like we just started talking. Are there any parting words or anything that you were thinking, I need to share this today and I didn't get a chance to?
I think the only thing I would say was that, Tavia, I know you and I and, a bunch of us, we offered these, Time Out for Caregivers programs. They are free support opportunities for parents to sort of have this live Q&A. We meet monthly, so definitely stay tuned for our next program, which I think is going to be in September.
Yeah.
And follow us along and make sure you get updated.
Great.
Yeah, the only other thing I was going to share is I think sometimes people can have the sense that the three of us must have our diabetes perfected. And I just have to share this story. So we recently were in the process of selling our home, and it was our first showing, and I had all my pets in our car, and we had to be out of the house for a couple of hours, and I was pre-bolusing because it was during the dinner time, and I was pre-bolusing, and during the pre-bolus my pod failed. And so I'm reaching into the back seat
Worse.
thinking, yes, and all my insulin is safely tucked away in the refrigerator drawer at home. And just a human, like, these are the things that are coming at us and doing everything right. And yet diabetes in life just still happens. And so fortunately I was okay. I got enough of the pre-bolus that I could limp along for the next hour before I got back. But I was reaching in the back seat, where do I have all my backup gear? And thinking I didn't bring extra insulin. But this is life. We're
Yes.
just human. Yeah.
Yeah, great. Thanks, you guys. All right. Well, we hope you guys enjoyed our podcast today, and we hope you guys who are listening will share the information and join into future sessions. And feel free to send us emails. Go to our website, integrateddiabetes.com. You'll find a lot of additional information that can be helpful. And our contact info is all on our website as well. So if you have you want to reach out to Anna, myself, Tavia, or Kristi, you can look at our About Us information, and there's a contact button there. So have a great day. Thanks.